Okay, welcome everybody for watching this video of the Academy of Biomimetic Dentistry. I have with me today someone who probably needs no introduction, the one and only Dr. Pascal Magne. How are you, sir?
Hello, Matthew. Nice to see you. I am great, despite everything we are going through right now, a little bit of crazy world, right?
Absolutely.
It's good to be there and, share some positive thoughts in the midst of this situation.
Well, it's funny you bring that up because here at the Academy of Biomimetic Dentistry, we're actually going through some big changes ourselves. We were not able to have our 2020 live event, but now we're doing all of our content and our webinars online. And it seems like people are really taking to this, and it seems like they're liking it.
I think it's, the positive part we take from this, and a lot of technology came to fruition with this pandemic. And, as a speaker, I'm also happy. I know that, dentistry is a lonely profession somehow for many. And so it's also important to meet each other. I was giving my first hands-on course since the pandemic this week, and I could see how, people need to socialize physically. It's very important, I think. And I'm looking forward, to go back to hands-on courses and stuff like that. But meanwhile, absolutely, we have to do what we can with the technology.
Absolutely. So you're actually coming up you're going to be our fifth presenter in December, which is going to be amazing because you put together a really great curriculum and some great topics. And I'm going to pull up the webpage right now where people can go to register. And we're just going to kind of talk through what you're going to be discussing to see if this piques anybody's interest.
Absolutely.
All right. So the first thing I want everybody to do is drive on over to the Academy of Biomimetic Dentistry website. You can probably see my screen right now, and I'm on Dr. Matt Najad's webinar, which we had in October. So what you're going to want to do is go to the ABD website. You're going to want to go to webinar registration. And once you're on this page right here, you're going to see Dr. Pascal Magne's webinar page, and he's going to be it's going to be an easy way to register for the upcoming webinar. So he's over here, he's discussing what you're going to be learning. So go ahead and read that. Actually, I've got Dr. with us. So why don't you explain to us, sir, what are we going to be learning on your webinar, our 60-minute webinar?
So it's very important that, we realize the true definition of biomimetic dentistry, because I see that there's been a lot of use and misuse of that word that I noticed, and some dentists want to endorse this concept, but are not necessarily aware of what it is. So we will talk about biomimetic dentistry, the big definition, and also what makes it unique in the restorative approaches. So. And as I always say, when people ask me, what is biomimetic dentistry, the first thing is falling in love with nature, falling in love with the beauty of natural teeth. And that means respecting that the intact tooth with enamel and dentin is the one and only reference we have, and we need to copy, right? So we have enamel dentin, we have composite resin and ceramics. They are amazing to copy the natural tissue. But the cornerstone of the biomimetic approach, is the bonding, right? We all know that enamel and dentin are perfectly united by this biologic bond, this amazing dentino-enamel junction. And this is our model for dentin bonding. And one of the most critical development, in my opinion, in dentin bonding is the development of immediate dentin sealing. So we will be talking about immediate dentin sealing a lot and place all the foundations. We have lots of new material about immediate dentin sealing, especially how to make it more universal, especially when using more the newest universal adhesives. And so that will be the first part of this seminar. Then we will look at, what bonding what are the consequences of high quality bonding? Well, you will see that the consequence of high quality bonding will be the total abandon of retention and resistance form. We will see that retention and resistance forms are concepts from the past when you consider the biomimetic approach. And that includes, of course, posts. So I will show you some very new data about post and core buildups and how basically those are, again, concepts from the past. At the end of this seminar, I want to spend some time with what I call the cherry on the top, and is more the aesthetic aspect. I always say, Mark, biomimetics is first biology, mechanics, function, and aesthetics is really the cherry on the top. Aesthetics is not the driving force of biomimetic dentistry. Aesthetic is the result, is the outcome. So I will finish with that. And one of the best tools in aesthetic dentistry that has been developed is called the mock-up. Some call it the virtual aesthetic trial. Some call it, the test drive. Some call it different names. That's not important. I call it a mock-up, and it's made from a beautifully developed wax-up, which can be handmade, which can be done digitally. That's not the important. As I always say, CAD/CAM tools, digital tools is not a philosophy, it's a tool. It's a tool, not a philosophy. The most important here is to understand the philosophy of aesthetic approach, and it has to do with diagnosis and testing and prognosis. So we are doing that in aesthetic dentistry with what we call mock-ups, and I will go over this topic as, if you want, the dessert of this presentation. So that's in a nutshell what we will be speaking about, Mark.
That sounds like you could fill up a whole day with those three subject topics right there.
I'm a little bit worried I will have to go at a good pace. So before the lecture, get ready, drink a lot of coffee, really some concentration, vitamins, and you should be okay.
Yeah, you should be okay. So let me ask you, who should attend this lecture? Should this be the advanced biomimetic, the newbie?
I like to be quite open platform, so I think it will benefit everybody, whether you're advanced or not. There will be research, there will be clinical stuff. I don't see any limitations. All levels, I think, should be benefiting from that. So, yeah.
One thing that you're doing that we've noticed here at the Academy of Biomimetic Dentistry is a lot of the younger dentists are following you and checking you out on Instagram and everything that you're doing. And so if any of those younger dentists who maybe are even still in school or just coming out of school are catching this video, I mean, this is perfect for you to come in, because you can start your career off and start out your
Absolutely, yeah. Yeah, I think that video should give you a lot to think about if you are like the new generation. This seminar will give you some very strong foundation to look at things maybe, or I should say certainly, different than what you've received in dental school.
Right.
That still there's a number of dental schools who are resisting this evolution. Of course, I can understand change is never easy, right? But to reassure you, all those young colleagues watching, we changed a long time ago. So this is not even something that should be considered new, but unfortunately it is for many. But these changes, we started to apply them as early as the 90s, the mid 90s, from the last millennium. So it's something that I can say I wouldn't teach something that's just coming from the last reign. These are concepts we've developed over a long period of time, lots of research, experience, science, common sense, and also that's one thing that I think people forget about biomimetic dentistry sometimes, is that Biomimetic dentistry is for everybody. It's not an elite work. It's not only for the wealthy. No. That's totally wrong. Biomimetic dentistry is also looking at the patient's need and giving the patient the best treatment according to their needs. Economic needs nowadays is a big challenge, right? And you know what we've learned is we can do a lot more with direct composites as a social economic approach than we thought originally we could. And so I think that's part of biomimetic dentistry too.
Well, I appreciate your time here, and hopefully this little glimpse into what Dr. Pascal Magne will be talking about will intrigue you enough to show up. We want you to come join us, check it out, and if you like what you see, maybe you'll even end up becoming a member of the Academy of Biomimetic Dentistry as well. So any parting words, sir?
Thank you, Mark. Great pleasure. See you all in December. I really hope. And as my, you know, I love what my colleague Dave Allman always says, my dear friend Dave, you know, get bonded, stay bonded until then. Okay. Always.
I love that. That's right.
Thank you, Matthew. Have a great one. Bye-bye.